Alright, my name is Arturo and this is my AK video. I'm going to start with my fixation muscle scan. So first I'm going to have the patient do the Superman, so stick your hips up and you're going to lift you up. So I'm going to press down on his head and that will be testing for lumbars. And if that will result in positive, then I will have him therapy localized on the lumbars. Go ahead and do Superman again real quick. Look to your right. And that's going to test for the right SI, and if that becomes positive, then I will have them therapy localized on the right SI. Look to the left real quick. Good. And if that's also indicative, then I will have them therapy localized on the left. If both sides are weak, then I will have them, that will be a sacrum problem, so I will have them therapy localized on the sacrum. Next, I'm going to have this arm sticking out, and that's going to test for, go ahead and resist. And that's going to go ahead and test for the CT junction. And then if that's indicative, I will have a therapy localized in the CT junction here. Next, I'm going to go with thoracolumbar junction here. Go ahead and resist. And if that's indicative too, then I will have a therapy localized in that area. Next, I'm going to do thoracics, or make a fist. Good. And that will be for thoracics. Next, I'm going to go with upper cervicals. So I'm going to use a glute max. Go ahead and go ahead and resist. Hold it there, resist. And if that becomes indicative, then I will have them therapy localized on upper cervicals. Next will be lower cervicals, and I'm going to use the patellatus muscle. So have them resist as I pull out. And that's indicative, and I will have them therapy localized on the lower cervical area. Next will be the psoas for the occiput. You can go ahead and face up. Alright, so take the left leg, out 45, up 45, out 45, and you go ahead and hold. Go ahead and put your arms on the side. Alright, sorry, no, come this way. There you go. Hold, resist. That's psoas, and if that's indicative, then I will have them therapy localized on the occiput.